Like most small hospitals, Flaget Memorial and Bardstown, Kentucky doctors who care for patients during the day would take calls at night. That meant when a patient needed a doctor at night, a nurse would contact the doctor by telephone for consultation and, if necessary, a drive back to the hospital after dark. Not perfect, but the best solution because a full-time doctor in the hospital at night wasn't practical. Eagle Telemedicine's nighttime telehospitalist service changed it for the better. Here's Flaget patient Ray Young on his experience with nighttime telehospitalist care.
I was walking up the hallway from my station in surgery, and I met this robot coming down the hall, and it spoke to me and called me by name. And I wanted to know what was going on and how it knew my name.
At first I was unsure because it was new. My biggest concern was how well the patient was going to take the idea.
When the telehospitalist came into the room, she immediately looked at me and said, "Oh, I remember you. I checked you in." And I immediately bonded with that doctor.
The major role of the telehospitalist at our facility is for nighttime admissions and patient care when issues arise during the night.
Well, I like the idea that the telehospitalist spoke to me directly and remembered who I was.
I've heard from several patients that it was like the physician was right there. I hear that very often.
Well, the telehospitalist and the nurse seem to be working as a good team.
They have labs, data, x-rays, all that at their fingertips while they're with the patient. They are able to communicate one-on-one just like I would if I was at the bedside.
I communicated with the doctor just like she was standing there facing me. And she says, "Well," says, "you've got a nasty little bug in your left lobe, and it is pneumonia."
Patient satisfaction is so important. When I go home in the evening, I know that my patients are going to receive good care if there's any emergencies during the night.
The experience was different, but after I bonded with the telehospitalist, it didn't make any difference.
Before the telehospitalist service was implemented, I would be on call at night after working 12 hours. I would get phone calls through the night, it would interrupt my sleep, and I would suffer the next day. With this service, I'm not on call. From the nursing point of view, it's a big advantage as well because I know they didn't like calling me at night.
Overall, it was, I would say, just about as well as my family doctor. Yes, after I bonded with the telehospitalist, I just forgot that my doctor wasn't there.
We've had telemedicine here at this hospital on a daily basis for over 4 years.
I highly recommend a telehospitalist to my friends, family, or just anyone that needs it.
As a physician who's worked closely with telemedicine, I highly recommend the telehospitalist service.
With nighttime telehospitalist coverage, patients get the expert care they need when they need it. Daytime doctors are able to have a better lifestyle and peace of mind knowing their patients are well cared for. And nurses have a doctor ready to see their patients in the middle of the night. With telemedicine, a doctor can be more efficient and expand their availability to hospitals and patients.